Managing healthcare in any country can be a challenge. However, here in Barbados, through proactive planning, professionalism and dedication, the Ministry of Health is striving to maintain a healthcare system of which you can be proud. Hello, I'm Inniss, and in tonight's edition of In the Spotlight, Minister of Health Donville Inniss speaks about efforts to create a sustainable healthcare system. In recognition that the rate of a country's development is determined by the well-being of its citizens, government continues to give priority to health care. In these economic times, however, some rationalization is necessary.
There are some people who believe that I am a minister who is trying to cut costs at every corner. Before I became a minister, I was an entrepreneur, and I've always learned that, sometimes you have to spend money to make money. Sometimes it's not always a matter of raising the price of your product, but looking to see what inefficiencies you have in the business that can be eliminated in order to reduce your operating costs without adding any additional burden onto the consumer. And such principles, I believe, I seek to apply to in the public healthcare system and the healthcare system in Barbados on the whole. Because healthcare is free, at least free to the end user, it does not mean it has to be abused. Because the healthcare system in Barbados is primarily financed by taxpayers at a cost of almost $400 million per year, it does not mean that we have to turn a blind eye to inefficiencies, duplication, and wastage. At the end of the day, it is your taxes, it's my taxes, is financing this system. I have a commitment to ensure that Barbadians get the best possible return on their investment.
Just like a business or home, there are costs associated with running a ministry. Minister Inniss noted that he didn't think the public was fully aware of some of these costs.
Take, for example, a basic matter like telephone. You will be amazed at what the telephone charges are in the Ministry of Health. I don't think the average Barbadian realizes that our telephone bills are in excess of $100,000 per month. Now I ask myself, if this was my business, what would I do to reduce my telephone bill? Would I go to voice over IP? Would I have a modern PAB system? No, these are matters now that the officers have been mandated to go and address. When you look, for example, at the fact that the electricity bill at the Queen Elizabeth Hospital is now nearly $600,000 per month, I have to ask myself, well, what is wrong? Does it have to be so high? So you ask the QA staff to go and look, see how we can be more efficient over there. If you can reduce the electricity bill by 10% per month, that is $60,000 that could be deployed elsewhere.
Significant amounts are also spent on the Barbados Drug Service. This, along with high levels of wastage, prompted health officials to make changes to the drugs on the formulary and to reintroduce a fee for drugs dispensed by private participating pharmacies.
For many years, the Barbados Drug Service has been providing medication free of cost to citizens and permanent residents of Barbados. So you go to the doctor, whether it's a doctor in private practice or in the public sector, receive your prescription, and once the items on the prescription are on the drug formulary, you go to either a public or private pharmacy, you receive the medication. There is no charge. However, what Barbadians have not realized or did not know is that apart from the cost of the medication, the Barbados Drug Service has been paying private pharmacies in Barbados approximately $1.2 million per month to dispense the medication to those who come for the prescriptions to be filled. And in light of the tightening fiscal situation, we had to take some decisions. We negotiated and deliberated on it for a while, including having discussion with pharmacy owners, pharmacists themselves, patients, a whole range of stakeholders we consulted far and wide with, including physicians. And we came to what I consider to be a very informed decision, which is that those who seek to have their prescriptions filled in the private sector that privately owned pharmacies will continue to get the medication that is on the formulary free of charge. However, the dispensing fee or the pharmacist's charge for filling that prescription shall be borne by the patient who attends his or her facility. However, if you opt to go to a public pharmacy, one situated in one of our polyclinics, you will continue to receive the medication free of cost, and there will be no handling fee or no dispensing fee paid. I find this to be the most equitable situation. The other option really and truly is to go back to taxpayers of Barbados and say, well, give us another $20–25 million a year to run the drug service. I don't think that that is a fair approach to take.
Another area of concern to the ministry is the quality of care for the elderly.
These are the builders of this society, and they deserve the utmost respect and support and care in their golden days. I don't believe when one reaches the age of 65, anybody should put you out to pasture like you are a sheep without giving you any water or hay. And I've seen many cases, bad cases in society of neglect among the elderly. I don't want to scare anybody and tell you that it is epidemic in this society, but if it is one case, it is one case too much. I've seen elderly individuals who don't get good nourishment. Their physical surroundings are very bad and place their lives at risk. They may start to have some mental illnesses, and people think that they are foolish and mad, so you ignore them or you lock them away in a room. A whole complex range of issues. Now, our society has evolved over the years where people think that these elderly individuals in challenged circumstances should be placed away in an institution. So you call a geriatric hospital and put them there, or if you feel it, maddy, you call the psychiatric hospital and put them in there. These are human beings, and they deserve better treatment than that.
Though acknowledging that it may not be easy to care for the elderly, especially when it involves mental or physical challenges, the minister advocated that the elderly remain in a home environment for as long as possible through more home help or daycare programs.
It's not cheap, it's not easy to care for an elderly individual or any individual who may be challenged in this society. So I'm mindful of that. But our focus now is on more community-based care. And let us take care in the healthcare sector of those who are ill. We have a situation where, I was pointed out recently by the CEO of the QEH, the persistent number of elderly, and some not so elderly, who are left in the QEH. That you've been taken to the hospital, the doctors have done their best for you, they brought you back to a sense of normalcy, and they're determined that you should be discharged back to the community, the relatives. And lo and behold, days pass, the person is laying on a bed in accident emergency up on a ward.
Annually, government is spending millions in elderly care services, and the demand for care far outstrips supply.
Right now, we are spending $6.5 million per year through the Ministry of Health to provide residential care in private nursing homes for elderly individuals in this society. It's just over 200 individuals we are accommodating in private nursing homes. That is not cheap. In the, when you look at the 4 district hospitals around the society, we are probably spending in excess of $30 million per year on elderly care services out of the Ministry of Health, including our facilities that probably at best could accommodate 650 individuals. And in any given day, any given week, there are probably 150 people there waiting to get into our facilities to be cared for. And some of them are really in genuine cases that need to be taken care of in our facilities. But we don't have the resources to do it all. And we can't always be saying to taxpayers, give us another $50 million to build another building and hire more people, and keep expanding. The money has to come from somewhere. My approach is to look at it in a more holistic manner. First, what can we do to reduce the number of people who need to go to hospital and need to be cared for in our facilities? If we can reduce that number without having their healthcare compromised, keeping them longer in society and healthy environment, that is fine. The other issue is what more can be done in the primary care setting through our public clinics, for example, in terms of timely clinical interventions that allow these individuals to maintain a healthy lifestyle and stay out of institutions. But once it's determined that you are now to become a ward of the state, as I put it, it's my considered opinion that thorough socioeconomic analyses of each case must be done. I'm saying if you work hard and you have accumulated some assets and you earn a pension, part of the proceeds of that should be used to care for you in your golden days.